I'd like to welcome you back to the show. It's our pleasure to welcome one of our regulars, Paul Seegert. He's managing partner of PCS Advisors. What he does is he helps employers manage their healthcare costs, which is usually the second highest cost after payroll, but he also helps those managers get their employees better health care. And again, he does this through PCS Advisors. And I would encourage you to inquire with Paul Seegert. Paul, welcome back to the show.
Thanks for having me, Andy.
So I wanted to talk with you about a couple of things. One of them, there was a survey on large group employers about what was happening with healthcare benefits in this last year. And make a long story short, healthcare costs increased 8.2% in 2021. And part of that was prescription drug trends. They were very concerned about that. But the other thing they said is this: the mental health issues, both observed and anticipated as an impact of the pandemic. And we always argue this, that you can't isolate people without depression and oppression setting in, among a lot of other things, and that the impacts of the shutdown would exceed the impact of COVID.
Yeah, it's an interesting topic. If you go back the year prior, a lot of employers got kind of a pass in terms of that increase, and they took that as good news. I think there was a lot of misunderstanding around why that occurred. I mean, all we did was we created pent-up demand in the system, and we created additional problems, but we put a hold on access. So during the lockdowns, people couldn't access care. So claims were down for all these insurers in the neighborhood of 70%. The fact that employers didn't get big fat checks, refund checks, is still a head-scratching mystery to me when you look into how the medical loss ratio rules are supposed to work as part of the Affordable Care Act. But all that aside, they had a year that was kind of a pass. Pre-pandemic era increases have been tracking in the 6% range. Now that doesn't include the fact that employers have also been downgrading benefits year over year. That's been achieved only by watering down benefits and pushing costs to employees and putting 100 million Americans in medical debt to achieve a 6% increase on average. Now, continuing to degrade benefits, we see it pushing toward 9% in 21. And with inflation and all the other factors that we're seeing in 22, we're seeing even bigger increases in some markets coming out than were in 21. It's already been an inflationary expense for employers, and this is really alarming news.
So one of the other things we wanted to mention is, besides this increase in healthcare costs and including prescription drugs, there was also the Democrats' new drug price fixing law. And the pharmaceutical industry is saying that the one area of drugs that this is going to hit harder than anything else is cancer drugs.
Right.
That cancer drugs are, one of the leading drugs they do research on. Your thoughts on this?
Yeah, there's so many unintended consequences when we get involved. There are some common sense things that we should get involved in and make happen from a regulatory standpoint, like transparency, being able to know what things cost before you buy them, even in healthcare. But it seems we have a good habit of when we get involved and we pass rules, there are all these unintended consequences. And if you look at, we could talk about that and go back and look at the Affordable Care Act and all the outcomes of that were unintended. But to use our time wisely and answer your question, this really creates concern for me, this Inflation Reduction Act, where we're giving Medicare the ability to negotiate drug pricing. It's a couple years out before it starts. There's oftentimes delays just to get things passed. But when it does occur, what we've essentially said, if you read the rules, is that Medicare can go to a drug company and say, hey, look, this blockbuster drug of yours, I know you want $10,000 for it. We're going to give you $1,000. If you don't say yes, we're going to charge you an excise tax that's equivalent to, say, 95% of the revenue you create on that drug outside of us. So it's really a gun to the head negotiation. Price fixing is perhaps more accurate, because it's not a negotiation if you really can't say no, or you don't meet in some middle ground. So they're going to create this dynamic, and naturally they're going to end up targeting cancer drugs. Those are some of the most expensive drugs out there. So they're going to pick, say, 10 of the biggest expense drugs for Medicare. And I see a couple problems. One is the way that will impact development of new drugs. It's going to create some perverse incentives for some of these drug companies to actually slow down what they're doing in developing drugs in that area, and more importantly, maybe slow down looking for other cancers where a good drug might apply. Because if the drug becomes too significant on the radar of Medicare, if the revenue climbs too high, then their revenue could essentially go to single-digit percentages of what it was. So we're creating this bad incentive where it will slow down R&D, and it will slow down R&D into other potential treatments or other diseases where it could apply. Lots of cancer drugs can help with other cancers that have similar causes. So that has the potential for some real negative impact for consumers. That's one issue I see. Another really important issue that I see that's going to impact employers, which is where I work every day, is the fact that whenever you take cost out of one part of the system in healthcare, if you're not really impacting the whole system, then you're moving cost to another part of the system. You're squeezing a balloon. We see that with hospital charges. Employer plans pay more than 2 times what government payers pay when they show up at a hospital, because hospitals are looking to employers to make up for the shortfall from government payers. I fear that we're going to create the same dynamic in the drug market now, where the better approach would have been to say, let's clean up the cost, the waste attached to the cost of drugs, and benefit all consumers. Instead, the government payer is going to get to come in, Medicare, and say, hey, we're just not going to pay as much for these drugs. But there's nothing in the rules that says these drug companies can't turn around and say the cost of that drug just went up outside of Medicare, and cost gets shifted into employer plans, which have already been on a higher trajectory in terms of increased costs than other payers in the system.
Do you encourage people? Now, I know you advise companies and manage companies' healthcare costs. Do you encourage individual consumers to buy out of a Canadian pharmacy, for instance, to save money?
Sure. We even have that set up in an automated fashion within some employer plans. And some employers have an appetite for that, some don't. But there are lots of things you can do other than just go the normal route to eliminate waste from the cost of drugs in a health plan. And in fact, employers are leading the charge in cleaning this up. I don't have a lot of confidence that we'll clean it up from a government standpoint, from the top down. But there's employers who are automating that right within their own health plan. And they're not only doing that, they're sourcing drugs through cash pharmacies, where they can get wildly lower costs. They're accessing manufacturer coupons in an automated fashion. There's 4, 5, 6, 7 things they can do to drive down the cost of drugs. It's so dramatic in its impact that we see an employer plan might spend well north of $100 per member per month on drugs, and that can go down to $32 when you get all the waste eliminated. It's a huge swing. Wow,
folks, if you own a company or you work for a company, tell them about PCS Advisors, because that's going to ultimately save the consumer/employee as well as the employer. Paul Seegert, managing partner, PCS Advisors, on the web at pcsadvisors.com. You're listening to the Andy Caldwell Show. Stay tuned.